Hello everyone, I'm Paul from Krazin Medicine. We're going to continue with the study of the axis. The axis together with the atlas helps for different kind of head motion. The atlas is the one mainly responsible for the rotation of the head. So the atlas helps you to look around. The axis helps you to nod. Now the axis, just like the atlas, lacks a vertebral body. That is one major difference between them and the other vertebrates. They don't have a vertebral body. It's kind of like this part just substitutes for the vertebral body, so they lack a vertebral body. And then also the axis has something. It has this protrusion, this process, which is called the dent or the odontoid process, which fuses with this atlas at this point here. Now the axis has other parts too, just like a typical vertebra. It has here at the transverse foramen, it has the transverse process, it has the superior articular facet, it has its own bifid spinous process, it has its other part also. And then now we are going to be looking next at a typical cervical vertebra. So we've gone from our C1 to our C2, and now we are going to be looking at C3 to C6, how their structure looks like. So their structure is kind of like this. It is different from the others, from the first two that we talked about, because it now has a vertebral body. This is what we talk about when we talk about the vertebral body. And then this vertebral body, besides it, we have our transverse process, which has the transverse foramen only for the cervical vertebra. The other vertebrae, the thoracic, they don't have a transverse foramen in their transverse processes. Now the transverse processes of this vertebra, it has an anterior and a posterior tubercle. So if we look here, you can see the anterior tubercle, and if we look here, we can see the posterior tubercle. So it has we'll go for the sixth vertebra, that's the C6, the sixth cervical vertebra. This anterior tubercle is known as the carotid tubercle, because just in front of it is your carotid artery, and then it's a major site for checking of pulse or something. Now we have our spinous process that we all know about. We have our vertebral arc, our pedicule, our lamina. We have our vertebral foramen, which is in the middle here, this hole here. That's our vertebral foramen. Now we have our groove for spinal nerve, and the groove for spinal nerve is at this point here. You can see it well, the groove for spinal nerve. And then we'll look at that later, but there are nerve supplies from the spinal cord. The nerves go to other parts of the body, and then they pass through this part here to go out of the spinal cord. Now next we'll be looking at the cervical prominence, and then this cervical prominence is the seventh cervical vertebra. The seventh cervical vertebra is called this name because when you bend your neck, there is a protrusion it gives. This spinous process gives a protrusion, and then you can feel it. If you just bend your neck slightly and then put your hand on your back, you will feel a protrusion at that region, and that is your seventh cervical vertebra. So the cervical prominence, or the seventh cervical vertebra, is just like the rest, apart from this prominent part here. It has its own it has the vertebral body, it has the transverse process, it has the transverse foramen, and it has the vertebral the intervertebral foramen and the arc. So in our next video, we are going to be talking about the thoracic vertebra.